It's a coronavirus. It's not a flu virus. It's not Ebola. This new coronavirus is not going away anytime soon. It's likely to be 18 months before there is a safe and effective vaccine under manufacture. So let's all learn to live with COVID as a constant threat. But we need help. We need strong, community-based health services, the kind that used to exist in many societies, but have been dismantled. We need their help because if we've got symptoms of COVID, we need to be tested to see whether we've got the disease. We need to be helped to isolate ourselves. We need help to find our contacts since we started to be ill. We as humans are amazing when we work together and when we combine our forces. But what's happening internationally? For some extraordinary reason that I just cannot understand, leaders, or at least some leaders, seem to have decided that it's best to try to go it alone. We can't have the kind of systems leadership that's required to come through this without world leaders finding the time and the space and opening their hearts so that they work together for the well-being of humanity. Competitive leadership within nations and between nations will not empower people to find their way through this situation and to be strong in dealing with other existential threats, whether it's inequity or the destruction of nature or climate change. COVID is a test for us all. It's a test that we can pass, and it's a test that will lead to change.